Okay. I'd like to start explaining about what is OET, all right? And how I teach OET basically. So, right now, most uh I offer most of my students, okay, a combined course. So what is a combined course? A combined course is a OET course, right? So it's a combined with online and then these sort of Zoom lessons. Okay. So, in terms of online lessons, what is in the online compartment? Well, first of all, OET writing. That is, the lessons are provided online. Okay, so I got around about six OET writing lessons. And then I have another six OET writing, what do you call it? Like the part where I'm editing everyone's letter in a open recording. So I have about five students who are submitting their OET letters to me, and then I'm editing that. So that is OET writing. So it's probably not very likely that you will be teaching OET writing. The task in OET writing is to write a referral letter. That's what the task is. So you're going to write a referral letter, and it's going to be very important to be able to like take out information that's not like really necessary or important. That's going to be a very important part of the criteria. The reason why I'm explaining OET writing, even though it's probably not that likely that you will teach OET writing directly, is because I think it's good for you to get an overview of what the OET test is, and what it sort of involves. So let's go through OET writing first. Now, I'm just gonna go here. OET writing. There we go. So OET writing and speaking is a part that is specific to each profession. So that is nursing, physiotherapy, um, medicine, that sort of thing. So the case is a little bit different according to profession. OET reading and OET listening is same across all professions. OET writing is marked by examiners according to a criteria sheet. So is OET speaking. OET listening, OET writing is, well, I guess scored by a computer. You just choose the correct option. Okay. So let's first start by explaining OET writing. There we go. So this one here, I've got the OET writing for doctors. So you've got 5 minutes to read, 40 minutes to write. And the case here kind of looks like, what would the medical note look like? So it looks very similar to medical notes. Not all information is going to be relevant to the writing, okay? And that's going to be a very important part of writing is choosing the correct information. So we have this case here. Assume today's date is 10th of February 2019. Mrs. Priya Sharma is a patient in your general practice who is concerned about her glucose level control. So we have Mrs. Priya Sharma, age 60. Okay, she lives in Newtown. She's been married for 40 years, has three adult children, five grandchildren, who's overseas, retired, cleric clerical worker, so that means well, she was a clerk. Many relatives with type 2 diabetes, nothing else significant. Medical history, type 2 diabetes diagnosed in 1999, nothing significant, no operations. She's allergic to penicillin, menopause for the last 12 years, never smoked, no alcohol, no formal exercise. So she takes metformin, she takes glipizide, no other prescribed, or recreational, or over the counter. Okay, so she's concerned about her glucose levels are not well enough controlled. So no, sorry, not she's concerned, just concerned that her glucose levels are not well enough controlled. Checks levels often and maybe a bit worried. So maybe she's worried here. Attends healthcare, feels not taking her concerns seriously. Okay, yeah, so she's concerned that her glucose levels are not well enough controlled. And she attends healthcare, feels that her concerns are not taken seriously. Recent blood sugar levels is 6 to 18. She checks her blood pressure at home. Last eye check in 2017 was okay. Weight is steady, BMI 24. Appears good, good diet, bowels normal, nutrition normal. Oh, sorry, nutrition normal. So, 18th of June 2018, presenting complaint, dysphagia, onset 2 weeks ago, post-viral. Uh, URTI self-medicated with OTC. URTI, just trying to see what that is. URTI. Um, Upper respiratory tract infection, of course. Self-medicated with over-the-counter, Chinese herbal product. Contents unknown, no relapse, remittent course, no sensation of lump, no obvious anxiety, concomitant epigastric pain radiating to back, level T12, weight loss of about 1 to 2 kilograms, recent increase in coffee consumption, takes aspirin occasionally 2 to 3 times a month, no other NSAIDs, provisional diagnosis gastroesophageal reflux, plus minus stricture. So plan, refer to a gastroenterologist for opinion and endoscopy if required, decrease coffee and alcohol intake, cease over the counter product, and then to prescribe pantoprazole 40 milligrams daily. So using the information in the case notes, write a letter of referral for further investigation and definitive diagnosis to the gastroenterologist, Dr. Jason Roberts at Newtown Hospital, 111 High Street, Newtown. In your answer, expand the relevant case notes into complete sentences. Do not use note form, use letter format. And basically, the sample letter that you're going to write is going to look like this. So this is another different case, but I'm going to show you what it's going to look like. So it's going to look like this. So you're going to have your address here. You're going to have the date. You're going to have who it's for. You're going to have regarding who it is. This first paragraph is called the purpose paragraph. Okay, so it's very important that the purpose of the letter is very apparent in this first paragraph. Now, it's important to consider whether the patient and the healthcare professional that you're referring to have an existing relationship or not, because that changes quite a lot of what information you're going to include here. So, for example, if you're writing a letter to the GP, you're not going to include hardly any about the past medical history, because you're going to assume that the GP should already know. So you're going to include, let's say, if you're a hospital nurse, then you're going to be mainly including information regarding, how they were at the hospital, maybe a little brief introduction about how they presented to the hospital, what tests they had, what treatments were given, how they responded to that, and if anything was changed about the medication regime or if they started on an exercise program. And then main part of the letter is going to be recommendations. So what do you want the GP to do? So here we have the purpose paragraph, which is I'm writing to refer Miss Parker into your care following an open appendectomy to remove a perforated appendix. She will need your assistance in monitoring the surgery site as well as with compliance to the post-operative discharge plan. So first, you have like who, what, when, where, why, that sort of thing. Like you're going to introduce why you're writing the letter. So I'm writing to refer Miss Parker into your care following an open appendectomy to remove a perforated appendix. And then the second sentence in the purpose paragraph is always going to be request. So you will need your assistance. So why you're writing the letter, assistance in monitoring the surgery site, as well as with compliance to the post-operative discharge plan. And this is written to the community nurse. Some things to keep in mind with OET writing is with, whether you're going to use British English or American English, you have to stay consistent. So if you're going to use British English, which I recommend most of my students to go with British English because most of them are in Australia, will be practicing in Australia, which will mean British English. Then what I do is, yeah, I tell them to do British English and some things that I was not aware of until I started with OET about like, what's different in British English formats and, American English formats is, for example, Mr., Mrs., that sort of thing. We don't put a dot after it when it's British English. You would always put a dot after it if it's American English. You would only put a dot after it if it's professor for medical English, for British English, sorry. Why you put a dot after it? That is because professor, it ends with an R, right? Whereas like Mr., it ends with an R and it's abbreviated MR. That's why you don't put a dot after it in British English. Whereas professor, it ends in an R, but in the shortened form, it ends with an F. That's why you put a dot after it for British English. So yeah, those are the kind of things that I was not aware of about differences between British and American English. Another one is, for example, if you have a sentence, right? So I like apples, bananas, and pineapples. This is British. Like this punctuation is British. If it's American, you're gonna put comma before the bananas as well. So before the end, you're gonna put the comma. But because we're gonna go with British, we're not gonna put a comma. So yeah, those were like very, very interesting points about the difference between American and British English. Um, Other things that we coach students on in the OET writing is about the formality, okay? So for example, you want to use more formal words compared to more informal words. So it's always hard to come up with examples off the top of my head. But let's have a look. Monitored. Let's say you want to say monitored instead of like, please look out for, right? Monitored is more formal. Um, Her parents were told to. It's quite casual. You want to say her parents were instructed to. Okay, so those are sort of the more formal terms. But yes, so this is pretty much the OET writing task. You want to always end it with yours sincerely for OET if you know the name of the person. If you don't know the name of who you're writing to, let's say if it's just the community health team and you're not given a specific name, then you're going to write yours faithfully. Again, I did not know of these differences until I started teaching OET. So these were all new to me. I was like, oh, cool, I didn't know. So yeah, yours sincerely is how you're going to always end it. You're not going to write your name because that could affect, well, fair marking. In case the examiner or the marker knows that person, it's going to affect the scores. So, you don't want to write your name. You just want to write just ward nurse or nurse or something like that. You can have as many paragraphs as you like. You want the word count to be between 180 to 200 words. So that is from here all the way to here. So this is going to be 180 to 200 words. And then you really want to think about the existing relationship, what is important to include, what is not important to include. Most of the time, like, family history or social history is like, unless it's important, you cut that out. Past medical history, you have to really think about what is important to include, and you think about existing relationships and that sort of thing as well. And then, yeah, you want the first paragraph to clearly state out what it is. And yeah, so please feel free to pause and read through the letter to give you a better idea of, what is the expected kind of, yeah, what is expected in OET writing. So that is all for OET writing. Now, let's move on to OET speaking. Now, Sorry, my bad. OET speaking. Here it is. So, in terms of OET speaking, here it is. Here's the resources that all of my students are going to get. So I've got cases here on the left side. So this top two, this is about the marking criteria. And then this is going to be the case. Before I get a student to start with you, I think what I'll do is I'll make these cases bilingual. So I will put a Japanese translation underneath for reference. I'm going to put higher level students with you. So really they shouldn't have an issue. But either way. So from this moment onwards, I want you to kind of like listen to this and think about what you might do differently. Because I'm all for that. I really want you to think about what you would do differently, how you would like to run your lessons. Um, as long as it is practical, as in they're actually practicing the case. I'm not too strict about how you feedback to them, what kind of things you focus on, that sort of thing. And if you want to give extra homework, please go ahead. Yeah. And then after watching this video, if you could please feedback to me about how you plan to run your lessons, or if you have any questions, please ask me. But yes, I would love to hear that rather quickly than later, so I can really sell your lessons to my students. Okay, so first let's have a look at the two criteria. So we've got linguistic criteria and the communication criteria, marking criteria. Now, something I did not do previously that I am sort of considering doing from now on is marking my students' OET speaking and then feeding back to them with specific scores and going through the criteria and giving them more specific feedback. So I used to give them much more general feedback, right, based on the things I've noticed. So what I used to do is we'll have like the role play here. I'll explain through the case, okay, and then we'll go through the role play. While they're talking, I'll try and write out like everything they're saying. And afterwards, I'll go through what I've written out and then, send one sentence by another, like, by sentence, I'll go through, edit, say like, oh, you could have said this a little bit more, like I would have said it this way. This is how I recommend you say it. And then we sort of, by the end of the actual, like, case, we come up with um, you know, a transcript pretty much of what you would say. But what I didn't do was go through the criteria specifically and feedback to them. So that is something I want to get started with. The homework has always traditionally been like, okay, so I know that we came up and then worked through the case and then come up with a transcript. Now try not to look at the transcript. Try to look at the role player card and the candidate card, and then write out the whole like nurse, patient, nurse, patient, nurse, patient, and what you would say. And then let me know and I will edit that. That's what I've been doing for homework. Um, and then I've been recommending my students to like just memorize it, right? So after it's been edited, please memorize that. The reason why I'd ask my students to memorize is so that they have phrases in them, because in clinical practice we're not always speaking diverse English. We have like pattern that we always repeat and use and use and use, and I want them to get used to that pattern. So that's why I would ask them to memorize the whole thing. Now, let's have a look at the marking criteria. So here's a linguistic criteria. This is not too different from, test to test, IELTS, OET, TOEIC, all these English tests, right? So it's rated between 1 to 6. So intelligibility, ability to speak clearly so others can understand you. You need to pronounce words and sounds clearly, use the right tone of voice, and use stress and rhythm in your sentences. You need to pronounce clearly and correctly. Fluency. So this is about, speaking smoothly and at the right speech, not hesitating, like, that sort of thing. Don't speak too fast or too slow. You should not pause too much or hesitate when you speak. Think about a time when you had to break bad news to the patient. You would speak slowly and smoothly, pausing at the right moments to let the patient absorb the information. So yeah, it's not being too fast, not being too slow, being fluent. Appropriateness of language, so choosing the right words and tone for the situation. So you should use the words that a non-medical person can understand when explaining medical procedures or conditions. If you're explaining a complex procedure to patients, for instance, you wouldn't use medical jargon. Instead, you would use simple everyday language that the patient can understand. And resources of grammar and expression. So a wide range of vocabulary and grammar. You should be able to express your ideas clearly and without confusion. And you can Google OET. I would recommend for you to Google OET speaking marking criteria and just print it out for yourself. This is like I've like written out the criteria in a way that's easily understandable for the students because this is a student resource. Clinical communication criteria. So here's a marking criteria for this. So it's a little bit different to the linguistic marking criteria. So let's actually have a look at OET speaking linguistic criteria. Um, Overview. I want there to be like a marking sheet so you can just print out the marking sheet. Clinical communication criteria. Great. Oh, here it is. So, yeah, from 1 to 6. So I would recommend for you to just print this out so you can have it by you. I mean, you can feedback to them on specific areas, like how were their intelligibility, how's their fluency, how's their appropriateness of language, how's their resources of grammar and expression. And this is what I want to get started, like what I want to start doing as well in my lesson. Um, for lower level students who are really struggling, I don't do these sort of specific criteria, like criteria sheet-based feedback, because that can be a bit overwhelming for them. So I tend to just focus on doing the role play, fixing what they say, coming up with a transcript together. That tends to be less overwhelming. But for higher level students, I think this will be really, really good to really brush up their speaking. You might not do this for the first few lessons. Really, it's up to you though, what you want to do, whether you think it's going to be helpful for them. So this is how you'd mark it. So intelligibility, so pronunciation is easily understood, and prosodic features, so stress, intonation, and rhythm are used effectively. Easily understood, communication is not impeded by a few pronunciation or prosodic errors. Fluent speech at normal speed. Hesitation only occasionally indicate searching for words or structures, but it is generally appropriate. So that sort of thing. Here, you typically you would want your students in the clinical communication criteria. You want your students to get majority in each of these A, B, C, D, and E. So if it's A, you want them to get at least 2, B, at least 2, C, at least 2, D, at least 3, E, at least 3. So that's going to be the minimum requirements. Now, let's have a look to see what each of those mean. Now, here it is. So relationship building. Here I'm explaining a little bit more in detail. So that is relationship building is A. So A, relationship building. And then we have A1, initiate the interaction appropriately. A1, initiate the interaction appropriately. So introduce your name, explain your role, clarify why they attended. So like this. Hi, my name is Sakura. I'm the nurse at this clinic. Before we get started, may I confirm your name and date of birth, please? Now, what is different about sample tests and real tests is that in real tests, you're going to have a name and age of the patient, but in the sample test, they don't have that. You want to confirm their name and date of birth or age it really depends on the situation. So, for example, if you already know them, right? Like, for example, in this case, you already have an existing relationship with the patient. In that case, you don't want to be going through that whole thing again. So you probably start your case by saying like, hi again, it's Sakura. Hi, you're Mark's wife, right? Or oh, it's Susan, right? Or something like that. Um, or you might want to even say, oh, it's Susan, right? But am I good to call you Susan, or would you prefer like Mrs. Thompson? Just to get that first bit of marking criteria, which is initiating the interaction appropriately, greeting, introduction, nature of interview, that sort of thing. And then you want to find out how the partner has been managing since your last visit. So how's the partner, how's he been since the last time I saw you? Or something like that. So yes, the introduction is going to be quite different, depending on the case, right? Like if it's an emergency, you're going to introduce yourself differently. Like, hi Jane, I can see that you're in a lot of pain. I can give you something for it, but I just need to ask some questions first. Is that okay? That's going to be, if they're anxious, it's going to be different. If it's in between treatment, like, and you're going to start a new procedure, and that's when the case is starting, it's going to be something like, all right, Kim, now that I examined your foot, I'd like to ask some questions before we discuss treatment options. Is that all right? So if you already know them, it's going to be, hi, thanks for coming back today. How you been since I last saw you? So there's no like one right way of starting the case. And it's going to be it's going to change um, according to role plays. But yes, that's the first bit, is initiating the interactions. If you don't know them, if it's a hospital setting, the most general one is going to be like, hi, my name is Sakura. I'm the nurse in this clinic. May I confirm your name and date of birth before we get started? Is going to be the most common, most standard way. But basically, you want to confirm their name, introduce yourself appropriately to the situation. That's going to be the first criteria in relationship building. Second one in relationship building, okay, so this is A2, is demonstrate an attentive and respectful attitude. So basically you want to like attentive, look at them, right? Nod, look at them in the eye, and nod and listen to them, and then speak in a appropriate tone, and don't interrupt the patients, right? So many clinicians, actual clinicians, don't do this. They don't even look at you in the eyes. But yes, so that's basically, you look at them, you don't interrupt them, and you do listen to them. So that's attentive and respectful attitude. A3, adopting a non-judgmental approach. So for example, if you have an alcoholic patient, you're not going to call them, so I know you're an alcoholic. That's probably not the best way to start the case. So, or if the patient say, oh, I always forget to take my medication. You're not going to say, you must take your medication. You're going to say, I know it can be a bit difficult to always remember to take your medication. Let's think about ways that you can be more consistent with your medication. Sometimes it's a little bit hard for students um to do these things because the role play, they're under a time crunch, and they've got the task that they need to do next coming up. So they're like, they're thinking, holy shit, like I don't have a lot of time. So like when the patient's like, well, I forget to take my medication, like sometimes students can be like, okay, so next question. So they can sometimes follow the script a little too much, like a little too heavily, that they sort of, entirely miss these sort of things. So this is a very difficult balance, like how much you follow the script, or follow the prompts, and how authentically you respond. So there is no like one correct answer to this. It's a bit of that sort of, you need to have a good sense to these sort of things. So yeah, that's a difficult one. Now, next one. A4, showing empathy for feelings, predicaments, or emotional state. I can see it must be very stressful for you. It sounds like that's a worry for you. Could you tell me why you're feeling like that? That's awful. That sort of thing. So, next one is criteria B, understanding and incorporating patient perspectives. So we got B1, eliciting and exploring patient ideas, concerns, expectations. So, for example, okay, so you inject yourself daily. Oh gosh, I couldn't inject myself. Well, to explain the injection process, so sometimes this can come from following the case notes a little too strictly. Most of the time, case notes are kind, and then it will have a prompt to be like, ask why they're concerned or ask what their concerns are. So that's going to help them to actually be able to fulfill this criteria. And then this criteria is going to be whether you did it or you didn't do it. If you did it, you're going to get a tick. And you want to be doing the majority. So you want to be getting, yes, she did this, she did this, she did this, you want to be doing majority of these things. So some of the phrases for eliciting and exploring patient ideas, concerns, expectations could be like, it sounds like that's a worry for you. Could you tell me why you're feeling like that? It sounds like you're really not comfortable with that. Am I right? That sort of thing. You want to be careful not to put words into patient's mouth because that's also part of the criteria as well. So you want to be asking, you want to be starting with open-ended questions first and not assume too many things and then gradually go to close-ended questions. B2, picking up patient cues. So this could be non-verbal cues as well or verbal cues. So I'd like to refer you to a gastroenterologist for stool sample and for further investigations. I'm not too sure if that's necessary. Like, you know, you want to pick up on that. Yes, this is a standard procedure. You want to say, not sure. Could you tell me a bit about why you feel that way? And this, like, not sure. So you're repeating. This is called echoing. So you want to echo their concerns and explore a little bit further. B3, relating explanations to elicited ideas, concerns, explanations. So let's say if they said, "Oh, thank you for sharing your concerns earlier about the possible side effects of blood tests. I understand you're worried about any risks. Let me explain a little bit more about the safety." So instead of, the standard explanation for, blood test, you're going to be changing that explanation to match the patient concerns. So you're gonna, yeah, like, you're gonna change how you're gonna explain things. I guess, yeah, it's standard in clinical communication as well. You're not gonna explain, you're gonna change your how you're gonna explain. You're gonna explain as you explain, you're gonna address patient concerns. Um, Next one, C, providing structure. So this is important because if you don't provide any structure, the role play is going to go on forever. And so is patient interviews. So we must provide structure. I am sure that like you're pro at this already, but I'm going to explain it to you in terms of the OET marking criteria. So, sequencing the interview purposefully and logically. So, like introduction, history, lifestyle summary, that sort of thing. If you're following dot point by dot point, and I'm going to explain like this part next. If you're following dot point by dot point, it should not be an issue most of the time. Okay. Signposting changes in topic. This is quite important. Like, is it okay if we discuss assessment results? I'd like to reassure you. Let me explain. Let's turn to your test results now. That sort of thing. So we know, okay, we're talking about this now, like, signposting. I usually explain it to my students, like, imagine like you're like putting a big flag and saying, this is what I'm gonna talk about next. It's gonna make it much easier for, the patients to understand, the concept when they know what is coming next. So let me reassure you, like, let me explain. Is it okay if I explain about blah, blah, blah? One good technique with signposting is here it is. So this is a candidate card. This is a card that the students will be looking at when they do the role play. So they don't get to see the role player card. So this is what the examiner will be looking at. This is what the students will be looking at. So one technique for signposting is using these words that come up first. So may I confirm why you're here today? Okay, I'd like to give you some information about squamous cell carcinoma. Um, the resist request, this is a bit, I think this is a bit hard to signpost. I'd like to emphasize why it's important to remove your stitches now. So a lot of these first bits can be used for signposting. The bits before the brackets, so that can be used for signposting. Using organizing techniques in explanations. So C3. So for example, you want to say firstly, secondly, thirdly. So for example, let's say insulin injection. So firstly, you want to remove the cap. Secondly, you want to insert the needle. Lastly, blah blah blah. Or you might want to say there's three steps to doing the insulin injections. Or maybe lastly you could say, okay, so to summarize today's discussion, blah 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 blah. So that's C, and we got D, information gathering. Facilitating patient's narrative with active listening techniques and minimizing interruptions. So that's a D1. Active listening. Yeah. Go on. Yeah, I see. That sort of thing. Can you tell me more about that? Yeah. So this is like, um, not talking too much, basically. Not cutting in, summarizing, and then confirming the understanding. Okay, so so what I understand is that blah 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 blah. You could use this summarizing and confirming understanding. You could use that at the start of the introduction. So usually you're given with a bit of a prior background. So you could say like, "Hi, Mr. Smith. My name is Sakura. I'm the nurse at this clinic. So I understand that you are here for removal of a skin cancer patch. Am I correct?" Maybe before I start with that, I might want to say, can I confirm your name and date of birth, please? I might want to get started with that first. Using initially open questions, appropriately moving to closed questions is another marking criteria. So that is this is D1, sorry, D1, this is D2. This is D3, not using compound questions or leading questions. So do you have chest pain and difficulty breathing? Is a compound question. You're asking two questions. Leading questions is your symptoms got worse because you forgot to take medications, right? So you're putting words into their mouth. So you don't want to do that. D4, clarifying statements which are vague or need amplification. So clarifying. So do you mean that the pain is constant or it comes and goes? Or when you say you feel tired, can you describe what that feels like? Or, could you give me an example of when this happens? That sort of thing. Oh, sorry, I don't know what happened there. There you go. And then last one so D5 is summarizing information and to encourage correction or invite for further information. So there we go. So that is this part here. Obviously, if you're trying to do everything in one role play, you're gonna run out of time. So really, you can only try your best. You don't have to be able to like do everything in order to get a passing score. Passing score for OET speaking is 350 or B overall. Okay. So, and what I might do is I might send you a archive lesson of a student who's like recently passed speaking, so you can have a look to see what a passing standard looks like as well. Okay, so summarizing information to encourage correction, invite further information. Let me make sure I've understood. The pain started 2 days ago. It is mainly on the left side and it gets worse at night. Is that correct? Or is there anything that I've missed? That sort of thing. And then E, information giving. E1, establishing initially what the patient already knows. So I always say start with assessment first, right? Assess first. What do you understand about insulin injections? Great one to do. Okay. Pausing periodically when giving information, using responses to guide the next steps. Yeah. Do you have any questions so far? How does that sound? What do you think? Encouraging the patient to contribute reactions or feelings. So, how do you feel about starting treatment? How do you feel about insulin injections? Um, many people, find this kind of news overwhelming. How's it for you? Checking whether patient has understood information, just to make sure, that I explained it clearly. Could you tell me in your own words how and when you would take this medication? This is a compound question, so you might want to change it a little bit. Does everything I've explained so far make sense to you? That sort of thing. Is there anything you'd like me to go over again in more detail? That sort of thing. Discovering what further information patient needs. Is there anything else you'd like to know more about? Are there any concerns or topics we haven't covered that you'd like to discuss? So these are the sort of things. So I hope that this gives you a clear overview of what they're sort of expecting in OET speaking. Now, let's have a look at the actual case notes. Okay, so you got 5 minutes. Sorry, my bad. 3 minutes to read through the case notes and 5 minutes to perform. Okay, now, um, if you're doing speaking online, you're not going to be able to. I don't think you'll be able to highlight because you're going to be doing it over Zoom. If you're doing speaking in person, you can probably highlight and write, into the case notes. So let's go through the case notes. So, your patient is 51 years old and has had a lesion removed from her hand following a diagnosis of squamous cell carcinoma. He was overexposed to the sun in his teens. You have come to remove the stitches. So, you want to confirm the reason for visit. And in the brackets, they're going to give you examples. You're not going to need to say everything in this, okay? This is just to give you some ideas about what to say. Um, Also, this is a medical English test. So it's an English test first and foremost. So it's not a thing to measure your um medical knowledge. So any medical knowledge that you might possibly need is going to be in the brackets as well. So you know, that's also another thing to keep in mind. Okay. Another good tip for students to be aware of is you got 5 dot points here. You got another 5 dot points here. So basically, after one dot point, please make sure that you get the other person to speak after the dot point. Sometimes it ends in a question, like find out if patient has any concerns. So that's great. It ends in a question. Sometimes it doesn't end in a question. For example, stress importance of patient skin monitoring, like checking for new changing spots, regular doctor checkups, etc. So then you want to add a question. And adding that question is going to be a great way for fulfilling that marking criteria, like, right? Like, so checking patient understanding or, that sort of thing, checking for patient's feelings. So that's a great chance for you to demonstrate that you can do all of those things. Well, great chance for the students to demonstrate that they can do all of those things. Okay, so 1 dot point after each dot point, get the patient to speak is another tip. Okay. Now, 5 minutes to read. Basically, you'll read through this. I would tell my patients there's no need for you to stay quiet while reading. If it helps you to read out loud, please read out loud. The examiner's not going to care. You got that 3 minutes to yourself. You can ask quick questions after that 3 minutes. So if you have any questions after that, you can ask anytime. Well, you can ask the examiner quick questions, clarifying questions. Okay. So let's have a look. Confirm the reason for visit. So removal of stitches, wound cleaning, redressing. Find out if patient has any concerns. So what this going to look like? Hi, my name is Sakura. I'm the nurse at this clinic. So I understand that you are here for actually, let me get started again. So I probably want to confirm name and date of birth first because this is the first time I'm meeting this patient. So please let me get started again. So I'm going to say, hi, my name is Sakura. I'm the nurse at this clinic. May I confirm your name and date of birth, please? Hi, yeah, my name is Mark. I was born on 9th of April 1970. Great. Lovely to meet you, Mark. How are you? Yeah, good, thank you. Okay. So I understand that today you're here for removal of stitches, and wound cleaning as well. Do you have any concerns? And this is what the patient's going to say. Well, the doctor said I had something called squamous cell carcinoma, which I think is just another name for skin cancer, but I'm a little worried. Yeah, of course. So this is you want to sympathize with them. Yeah, of course. It's a big word. I can see why you might be a little bit concerned. Now, let me give you some information about squamous cell carcinoma. I just signposted. So it's a type of skin cancer caused by sun exposure or ultraviolet radiation. Um, you know, is or you could check the understanding here. You could say like, um, like, were you aware of that? Or something like that. Or you could just move on, you could say. So the surgery is very effective for this type of cancer. So once you have the lesion removed, the cancer is unlikely to spread. It's very important that you continue to monitor your skin even after the surgery. So this includes checking for any new or changing spots and have regular doctor checkups. Now, I probably want to check understanding, right? Now, like I could say, how does that sound? What are your thoughts? Do you have any questions or concerns? Um, that sort of thing. When you think about the criteria too much, it can really trip you up, you know? So it's really a balance between like being aware of the criteria because that's what they're marking you on, but also like not being dragged by it too much that it really just stops your thinking completely and you're thinking, oh shit, what do I say? Because even I can get a little bit that way when I'm like too focused on the criteria. Um, I always wear a hat and then yeah, and then I say, okay, blah blah, how does that sound? Well, I have a better understanding of what squamous cell carcinoma is now. So yeah, here you want to check understanding, like, was that clear to you, or does that explain things a bit better, or something like that? Um, am I likely to need more surgery to remove other lesions in the future? Okay, so that's a great question. Okay. Um, and I need to resist the request for information about further surgery. So I will say something. That's a great question. However, I'm not the best person to answer that question for you. I think the doctor will be a better person to answer that question. Um, however, yeah, is that all right? Yeah, sure, that's fine. Okay. So can I find out a little bit more about how you are when you're like, outside? So do you usually wear a sunscreen or a hat? Okay, they're gonna say. I always wear a high factor sunscreen, 30 or higher. I wear a hat when I'm out in the sun, but I think it's a bit too late because damage has already been done. I spent too much time in the sun in my teenage years. Yeah, of course. So I can see why you might think that. However, it is very important that you continue to cover up when in the sun to prevent further damage. Um, Also, how's your wound been since the new surgery? Is there any pain or discharge? Um, oh yeah, I'll be sure to look. I probably want to, cut the cut the conversation, I guess here. Stress for ongoing prevention. Yeah, how does that sound? And then start the next one. But anyway, they're gonna say, yes, I'll make sure to look after my skin from now on. My wound has been fine. There's no pain or discharge, but I still think it's a bit too early to have the stitches out. Yes, of course. So I would say something like, okay, so you think that it's a bit too early to have the stitches out. Now, um, now I think, it's best to have your stitches removed now. This is for optimal wound healing. It's also been assessed by the doctor as well. And furthermore, stitches are typically removed after 7 to 14 days, you know. Um, are you happy to have the stitches removed? Yeah, yeah, sure. So then I'm gonna say, okay, so in terms of the aftercare, so please keep the wound clean, covered, and dry. And then yes, I've already established patient consent to have the stitches removed. So yeah, that's going to be the cases. Now, and then I will send a passing standard student for you to have a look at. I don't want to overwhelm you with too much information at once. So this is going to be the first half of explanation of OET. I'll send you another one maybe today or tomorrow. And then I'm going to explain about listening and reading as well. A lot of people do struggle with reading, so it might be good for them to do reading lessons as well. I know that it can be it's quite a lot of information for you as well. Um, but especially when it comes to speaking, I'm sure like you're the best teacher for them. So I'm extremely confident. Um, yeah. So yeah, that's it for now. I will send this recording through and also send a passing level OET speaking OET speaking student to you. But yes, thank you so much. It's a huge challenge and a huge jump for me as well. So I'm also quite nervous about it, but it's you got to be brave and you got to be courageous um about these things. So I always try to tell myself, like, well, you don't know until you try, you give it a go. So, try to keep a positive mind and an outlook. So yes, I will also send this one to you as well. All right. Thank you. Bye.